Okay, hello. Today I'm going to be speaking about coronary artery disease, also known as CAD. Excuse me. Okay. So what is coronary artery disease? Coronary artery disease is a cardiovascular disease that is known as damage or disease to the heart's major blood vessels. The usual cause of CAD is plaque buildup, causing the coronary arteries to narrow, limiting blood flow to the heart. This is a combination of plaque buildup and a lack of blood flow to the heart. So CAD facts. One person dies every 34 seconds from cardiovascular disease in the US. In 2020, approximately 700,000 deaths in the US were from heart disease, which is just about 1 in every 5 deaths that occurred in 2020. CAD is the most common type of heart disease. Just a little over 380,000 deaths in 2020 were from CAD. About 20.1 million adults at the age of 20 or older have CAD. In the United States, someone suffers a heart attack every 40 seconds, and every year about 805,000 individuals in the US have a heart attack. 1 in every 5 heart attacks are silent. Silent heart attacks are also known as asymptomatic, and asymptomatic heart attacks are usually found years in the future once an individual goes in for an EKG or an ECG and they see that the electrical stimulation of the heart is a little different than what it should be. So here we're going to speak about the deaths of heart disease by ethnicity or race, and here's statistics about the differences between males and females as well. So as we can see, the leading group in the United States from heart disease are the white individuals, followed by the Native Hawaiians or other Pacific Islanders. And then we have Black individuals, we have Asian individuals, we have Hispanic individuals, American Indian or Native or Alaska Native individuals, individuals with more than one race. And then if we accumulate all of the deaths that happen between males and females in every race group, that would accumulate to 20.6% of the deaths that occur in the United States. So out of every death, if we have the total of every death that occurred in the United States, 20.6% of all those deaths would come from heart disease. So symptoms of CAD. The main symptoms to recognize, or the main symptom to recognize with CAD is angina, which is also known as chest pain or discomfort. One of the reasons that angina can happen is due to the accumulation of plaque buildup in the arteries, and whenever there is plaque buildup, there is a narrowing of the arteries that lead to the heart, which eventually leads to a decrease in blood flow, which can cause pain in the chest. Unfortunately, for many individuals, the first clue that they have coronary artery disease is a heart attack. And symptoms of a heart attack include angina, we have weakness, lightheadedness, nausea, cold sweats, pain or discomfort in the arms and shoulders, and shortness of breath. A few differential diagnoses that we could have with CAD include acute pericarditis, myocarditis, acute bronchitis, pneumonia, GERD, costochondritis, pleural effusion, aortic dissection, and esophageal motility. It is very important to differentiate these things, and the way to do that is through hematology labs or through other diagnostic instruments to help us realize if an individual is suffering from CAD or if they're suffering from one of these other differential diagnoses that we just mentioned. So a few diagnostic methods that we could use to diagnose CAD include ECG or an EKG. What this is it's an instrument that places pads on your chest, and those pads record electrical stimulation coming from the heart. They also they measure the regularity of the heartbeat and heart rate. An echocardium is an ultrasound that creates a picture of the heart. Exercise stress test, what that is we place individuals on a treadmill and we allow them to walk, and then we record the efficiency of the heart and when it needs to pump more blood to its peripheral muscle tissues. Chest X-rays, they help create pictures of the heart, the lungs, and the other organs that surround them. Cardiac catheterization. What this is we insert a thin flexible tube that goes through an artery, and it can go through a groin, an arm, or a neck. And this is to check to see if there's any blockage in an artery that is leading to the heart. And a coronary angiogram. So this monitors blockage and flow of blood through coronary arteries. So a few risk factors that come with CAD or that could lead to CAD. Age. The older we get, the slower our bodies work. So age is one factor that could affect the possibility of developing CAD. Sex, genetics, and lifestyle choices. Out of those three, lifestyle choices are the ones that we can control the most. So that's why it's important to educate others on the effects that CAD could have on someone or cardiac disease. And we could demonstrate different types of lifestyle choices or an improvement of lifestyle choices and inform them on a better diet, on the benefits of activity levels, on alcohol consumption, on the amount of sleep they have, and smoking. And there's a very high correlation to smoking and CAD. So these lifestyles, especially diet, can affect the heart. Diets with high contents of saturated fat, trans fats, sodium, and sugar drastically increase the chances of developing coronary artery disease. Bad diets and lack of activity can lead to high blood pressure, and high blood pressure can harden and stiffen the arteries, which may lead to excessive narrowing of the arteries, and it could excessively slow down the blood flow to the heart. So high cholesterol levels, specifically LDL levels in the blood, can lead to atherosclerosis. So we want to have low levels of LDL and high levels of HDL. There's the LDL would be the bad cholesterol, and the HDL would be the good cholesterol. So effects on the body from CAD. Once plaque buildup begins to occur, the arteries in the heart start to narrow, and then this could eventually lead to myocardial damage and loss of efficiency in the heart muscles to pump blood where they need to be pumped, or where blood needs to be pumped. As the arteries start to narrow, the myocardial tissue begins to weaken, chest pain begins to develop, so angina, like we mentioned before. When there's not enough blood flow to the heart, it can cause arrhythmias, which is also known as irregular heartbeats. And after a prolonged period of time living with CAD, one could eventually experience a heart attack. In some extreme scenarios, it could lead to heart failure, and in some very unfortunate and even more extreme scenarios, it could lead to death. So this is what CAD looks like. Here we have a healthy artery. As we could see, there is no blockage for the red blood cells to move into the heart. And here we have the initial stages of plaque buildup. So this is already someone with CAD. And as you can see, there's a small buildup right here, but there's still a decent amount of area for the red blood cells to travel through. And here we have a severe plaque buildup. So this right here is where we start to have issues. And then these issues could eventually lead to blood clots. Whenever there's a narrowing in the arteries, these red blood cells start to get caught. And then if more blood cells get caught within each other, there could be a blood clot, which could lead to a heart attack due to a lack of blood flow being given to the heart. So treatment, how do we treat CAD? For individuals with a low amount of plaque buildup, the best treatment is exercise and an improved diet. This also goes for people who want to prevent CAD in the future. Increase physical activity, better diet, decreased alcohol consumption. And if one smokes, we don't want to tell them to decrease it, but we want to tell them to completely quit smoking because of the high correlation between smoking and CAD. Individuals who have experienced a heart attack before or heart failure are usually required to go into surgery or medical care, and it is recommended for them to go through cardiac rehabilitation to improve the quality of life and to prevent a future cardiac episode. So here I listed a few food alternatives that one can consume. As an individual who experienced a lot of heart difficulties as a kid, I learned the hard way, and this is something that has worked for me personally. When I was a kid, at the age around like 12 or 13, I was almost placed on statin medication due to having very high levels of cholesterol and high levels of triglycerides. I remember at one point in my childhood, my triglyceride levels were in the mid 600s. So it was extreme. It was very, very extreme. And at the time, I was not educated in nutrition, neither was my family. We were low socioeconomic, so we didn't have money to be buying the most nutritious, high quality foods. And I just had very, very poor habits, very poor exercise habits, very poor eating habits. And once I found alternatives, and once I realized the danger that I was in as a kid, I was able to find these alternatives, which helped me out a lot. And I still follow them to this day because I still I still am at risk of developing those heart conditions due to a history also of my family. I have a grandfather who experienced a heart attack around the age of 50 from my mom's side, and then my grandmother from my mom's side as well. She struggles with a lot of hypertension. Both of my grandparents from my dad's side also have very, very extreme heart conditions, and my grandfather from my dad's side actually experienced a stroke and passed about 10 years ago due to a lot of heart complications. So it's in my family, and it's something I have to be very aware of. It's something I have to keep up with on a daily basis. So these are the alternative methods that I found that work for me and that I would recommend to everyone else. So I myself, I love breakfast, and I like to eat a lot of eggs. So usually instead of eating like 4 eggs, I do one whole egg and about 5 egg whites. And not only do I consume less fats, but I also consume less calories with a higher amount of protein. So as we could see, one whole egg has 5.3 grams of fat compared to one egg white, which is an egg just taking out the egg yolk. It has 0.1 grams of fat. Ground beef versus ground turkey, 4 ounces, 13 grams of fat in ground beef and 9 grams of fat in ground turkey. Whole milk is something I used to consume a lot as a kid as well. So 8 grams of fat in 1 cup of whole milk. And almond milk is the only thing I consume now in terms of milk. So in almond milk for 1 cup, there is 3 grams of fat. For ice cream is one of my guilty pleasures, and it's something I used to eat a lot as a kid as well. And it's probably one of the reasons why I had very, very high cholesterol and triglyceride levels. And Bluebell was specifically the one that I ate a lot. So 2/3 of a cup of Bluebell vanilla ice cream has 12 grams of fat, compared to Halo Top ice cream, which is what I consume now, which has 2 grams of fat. And I mean, if we're being honest, 2/3 a cup is something that we probably don't stop at. We consume more than that. So let's say if we consume double 2/3 cups, a cup and a half, or whatever the case might be, we might be consuming close to 25 to 30 grams of fat with Bluebell, as opposed to 6 to 8 grams of fat with Halo Top. So there's a huge difference in the amount of fat that we can consume through this specific ice cream. And like I said, that's something that I found that works for me, and it's something that I recommend for other individuals who have a history of or family history of heart conditions. So disease and treatment, usually in initial stages, for individuals who want to prevent or are at risk of CAD or have a very small amount of plaque buildup, we want to just focus on exercise and a healthier diet. Once we start to have plaque buildup, or a higher level of plaque buildup, we want to have exercise and diet. and medications might be needed. And once we have a severe case of CAD, then exercise and healthier diets are definitely mandatory, and more than likely, prescriptions will be needed to help the individual maintain a healthier lifestyle. So we're going to speak about some medications here, and for different cases or for different causes and different purposes. So for angina, we have nitroglycerin, which dilates blood vessels and allows the heart to pump blood with less effort. And we have beta blockers, which slow the heart rate and lower blood pressure. It also decreases the amount of oxygen your heart needs to work. So this is specifically for for chest pain. For clot prevention, we have aspirin and these other 3 medications listed below. Like I mentioned, clot prevention is big in this pathology, because once the arteries start to narrow, red blood cells start to get caught, and then if there's accumulation of red blood cells in one area, it could lead to a blood clot, and then it could lead to a heart attack or cardiac failure. Fibrates, they help lower triglycerides and raise HDL levels. Statins, they decrease overall production of cholesterol, and this is the one that I mentioned that I had the chance to be placed on due to my high levels of cholesterol and triglycerides. And we have niacins as well, which increase HDL production, like I said, the good cholesterol, and they decrease LDL production as well, which is the bad cholesterol. So living with CAD. So CAD, once a person is diagnosed with CAD, it cannot be cured or reversed without surgical procedures. If an individual is diagnosed with CAD and they want to do something to cure it, they have 2 options, or these are the 2 main options that they have. The first one is coronary angioplasty and a stent replacement. So what the surgeon does is they go in through the artery with this mesh-like tube, and then once they get into this area, they expand it, pushing the arteriosclerosis or the plaque buildup back into the walls, allowing for a better passage for blood. The second one, which is the coronary artery bypass graft surgery, is a replacement artery. So if we're having a blockage right here, and the blood is supposed to be coming from here down here, what happens is there is an alternative placed for a different passage for the blood to go to, and provide more efficient blood flow to the myocardial tissue. This is an open heart surgery though, so this is something that gets taken very serious and usually used as a last source. So living with CAD, so now then this is the non-surgical procedures. So lifestyle changes is the biggest one. Like I mentioned earlier, if you don't want to tell someone to decrease their smoking, rather you want to tell someone to quit smoking. Nicotine has a tendency to tighten blood vessels and force the heart to work a lot harder than it should. Controlled blood pressure is another one. It goes back to the previous slides talking about blood pressure, which can narrow the arteries and make it harder for the heart to do what it has to do. Eating heart-healthy foods consisting of fruits, veggies, whole grains, and nuts. Increased physical activity as well. At least 150 minutes of moderate activity or 75 minutes of vigorous activity per week. So if we divide this into 5 days a week, we have 30 minutes of moderate aerobic activity, which could just be walking or going for a light jog, depending on your physical activity levels. Managing stress and maintaining a healthy weight. Obesity increases the risk of one developing CAD. So in conclusion, like I mentioned earlier, CAD is not reversible, but it is preventable if one starts at a young age, and being aware of what is being consumed and how the things that you can consume can affect your body in the future. Developing good and healthy habits, exercising, being aware of diet, avoiding excessive alcohol consumption, and not smoking. You know, like I mentioned earlier, this is something that I learned the hard way as a kid, but I'm glad that it happened to me as a young child rather than it happening now, where my body might not work the same way it did when I was 12 or 15 years old. So some individuals may run the risk of developing CAD at a higher rate than others due to family history. You know, I fall into this category as well, mentioning my family and all the issues that my grandparents from both sides have had. Once CAD is developed, it can only be controlled through medication and improving lifestyle habits. So like I said, CAD is not reversible. The only reversible, quote unquote, reversible way is through surgical intervention. One last thing, one emphasis is just be aware of what you consume and how much. There's nothing wrong with eating fast food. Just don't overdo it. If you want to eat fast food once a month, once a week, it's okay. Just be aware of how much you're putting into your body. Be aware of what you're putting into your body. Because at the end of the day, you know, you might not see a difference from here till tomorrow, from here to next week, but 20, 30 years down the line, it might affect you in a very, very negative way. And like I mentioned myself, you know, coming from a family who has had a lot of cardiac issues, seeing how my grandparents have had to deal with these things, and you know, even now, my mother, who is struggling with, you know, she's considered pre-diabetic and she has a lot of complications. It's very difficult to see, and it's something that I would like to prevent in the near future for myself. And these are my resources, and that concludes my presentation on coronary artery disease. Thank you.